So hello everyone and bonjour tout le monde. Thank you very much for joining Deloitte AI Institute Canada for today's panel discussion on AI in life science and healthcare. My name is Jason Gray and I lead Deloitte's government and public service and life sciences and healthcare practice for their Omnia data and AI program. So just before we begin, I'd like to start with land acknowledgement. We do acknowledge the Indigenous peoples of the lands that we are on today. Deloitte Canada has offices with representation across most of the country. We acknowledge that our offices reside on traditional, treaty, and unceded territories as part of Turtle Island, and is still home to many First Nations, Métis, and Inuit peoples. Lastly, the webcast is being recorded and will be made available on the Deloitte AI Institute webpage, and you'll be able to view this video in the language of your preference. Okay, so just to get started, a little bit of upfront context. I think all know that AI in healthcare is truly starting to push the boundaries of what is possible and is captivating the imagination and creativity of those looking to create meaningful change across the sector. However, I think we can probably also acknowledge that AI in healthcare has really only scratched the surface of its full potential. There has been accelerated use of AI for certain things, including automating repetitive tasks, standardizing business processes. But increasingly, we're seeing AI being recognized as a strategic business advantage that's actively being discussed at the board and C-suite levels. When we reflect on what's driving this demand, we have to look at what's happening in the ecosystem and some of the immediate needs, as well as the changing demographics of the healthcare system, where that system is facing increasing and growing demand for the services, including rising costs, resource constraints, and increasing administrative burden. It's estimated that by 2050, 1 in 4 people in North America will be over the age of 65, meaning that the health systems are going to have to adjust to deal with more patients with more complex care needs. And the reality is that managing some of these patients is expensive and requires systems to shift from more episodic care to one that's more proactive, focused on prevention and long-term care management. In building a healthier future we can thrive in, this is where we see the potential and opportunities created by AI. And it's no surprise, and even in the last week or two, we've seen an amplified focus on the adoption of AI, and more so adoption of AI in healthcare. What are we seeing? We're seeing an increased use of AI-powered chatbots and virtual assistants to help patients access the information and as well as schedule appointments, and increasingly help them to navigate the healthcare system itself. We're also seeing AI leveraged to remotely monitor patients within the comfort of their homes, and using AI to plan for more operational efficiencies where there's either projected shortfalls in resource management or where there's a desire to apply those resources more effectively and efficiently. So lots of promise, certainly in AI in healthcare, but what really needs to change to encourage the introduction and scaling of AI in health? So at a high level, and we'll get into some more detail as we go to the panel, requires people, processes, and technology really to work in harmony. We have to ensure patients' trust. We have to upscale some of our talents. We have to have a clearly defined digital strategy along with ways of measuring the return on investments of looking at AI and how it integrates into the healthcare system. And those are some of the top concerns that have been to date hindering to some degree some of the progress of successful AI adoption in many of the parts of the healthcare sector. So I'm going to go ahead to the next slide. So when we start to think about what does AI-enabled healthcare look like in the future, and you can see this is by no means an exhaustive list, but some of the things that are emerging as some of the trends where AI can, again, either currently or in a future state, directly impact on how healthcare is delivered. So we've done some surveys within Deloitte, and within one of the AI dossier, we found 80% of survey respondents reveal they expect AI and machine learning to improve treatment recommendations for individuals. And then similarly, over the next 3 to 5 years, that AI is expected to have a transformational impact as 50% of global companies will implement some form of AI strategy by 2025. And again, with all this buzz, it's important to keep in mind that AI in healthcare is still in its relative infancy. And so that the scope of that impact, the timing of the impact is all yet to come. Today, most of the use cases for AI in healthcare really focus on administrative tasks, basic automation, rather than some of the more use case driven, sophisticated clinical applications, including clinical decision support and care delivery. But some of those more advanced AI applications are already emerging that look at the practical viability of some more sophisticated use cases, including, again, in assisting radiologists in things like image diagnosis. But for most organizations, the single most important AI building block is data. It's getting access to the rich data that AI systems require, and then managing that data in a coordinated way across the enterprise. So some of the major priorities that we've seen across the industry include a deeper understanding of the healthcare consumer is foundational. So you've got a huge array of technology options, you've got lots of use cases, you've got a huge amount of data within the healthcare system, a lot of market hype. But again, there is a primary need for healthcare organizations to use data analytics to deeply understand their consumer, whether that's public, whether that's patients, whether it's clinicians, better understanding their needs to drive those needs back to understand, again, what are the data constraints and or opportunities that exist within their organizations. We also see AI shifting to execution at scale. So there's been lots of history of big ideas, lots of innovation pilots, sandbox environments. But what most healthcare leaders are really looking for is, again, practical technologies and practices to start to deliver AI at scale. And that we're also looking at how AI can start to shift the economics of healthcare data sharing. So those of us in the system know the cost of maintaining and growing the health data ecosystem is massive. AI offers opportunities to make both the cost and the efficiency of healthcare data sharing more efficient, and therefore, again, more accessible for things like AI applications. And then finally, we have seen some talent and governance barriers that are choking, the value delivery of AI. The people side is struggling in the sense that, we need to upskill people. We need to start to look at more appropriate and responsible methods of sharing data across ecosystems, whether it's a more integrated care delivery system or whether it's just more prolific access to data. These things, again, are currently oftentimes stuck in practices and policies that are decades old. We need to evolve the thinking around how data is shared effectively and appropriately. So, as AI becomes more of a standard business tool, organizations in healthcare and life sciences are going to need more of a clear vision and strategy for how they're going to harness that power. And they need to start investing in some of the building blocks to develop those AI solutions at scale, including, as I already mentioned, some of the data infrastructure underneath. So, looking at the current IT infrastructure, looking at the right talent and skill sets, looking at, again, the ecosystem in which they operate so they can understand the needs of their key stakeholders. And as they start to think through those things, they start to understand what are some of the quick wins, but also what are some of the initiatives where they can start the foundational work to drive to better data, more robust data, available for AI use cases so they can start to scale it within organizations and throughout the system. So just in wrapping up, what we're going to explore in this webcast is how AI can support improvements in care outcomes, how it can target things like better patient experience and access to healthcare services. And we've got a panel of very esteemed leaders from within the system. We'll hear again how some of these applications are starting to roll out within the Canadian healthcare ecosystem. So before we turn it over to the panel, we are going to invite you to participate quickly in a poll. If you want to transition to the next one. So, as a citizen, so again, many of you are practitioners within the healthcare system, but when you think about the system as a whole and as a citizen in that system, what ways would you envision AI transforming how you engage with that healthcare system? And we are asking you to kind of select your top choice, although many of these may apply. So if you can click on, again, which of these most resonates with you. If you have a fifth or beyond these particular options, feel free to enter additional ideas within the chat. But otherwise, if you can select which one of these, again, would most appropriately characterize how you would envision AI transforming your engagement with the healthcare system. We'll just give everyone a short amount of time to enter their choice, and then we'll take a look at what's emerging as themes. And again, happy to welcome additional ideas in the webinar chat. Okay, why don't we take a look at, I think that's given us one question, let's take a look. And thankfully, we do actually see a few areas just within the chat, including AI used for patients to become agents of their own health. Fantastic suggestion. As well as some comments about, again, what's crucially important, that the patient is not unduly stressed. So it looks like, just based on the poll, that we've got a front runner, which is enhancing health outcomes, including tracking symptoms. Not surprisingly, because again, AI for the purpose of AI is not useful unless it's directly impacting on the experience, both of clinicians and of the people who are working with those clinicians. Okay, and you can see again, although there was a front runner, clearly again support for some of the other ones as well. Okay, so with that, I'd like to just spend a little bit of time introducing our panel, and again, and I'll be turning over to Aisha to help to moderate some of the questions. So first, I'll introduce Dr. Mohammed Mamdani. Dr. Mamdani is Vice President of Data Science and Advanced Analytics at Unity Health Toronto and Director of the University of Toronto's Temerity Faculty of Medicine Center for Artificial Intelligence Research and Education in Medicine. That's a long one. Dr. Mamdani's team bridges advanced analytics, including machine learning with clinical management decision-making to improve patient outcomes and hospital efficiency. Dr. Mamdani is also a professor in the Department of Medicine at U of T, the Leslie Dan Faculty of Pharmacy, and the Institute of Health Policy Management and Evaluation at Dalla Lana. Dr. Mamdani is also an adjunct senior scientist at the Institute for Clinical Evaluative Sciences and a faculty affiliate at the Vector Institute. In 2010, Dr. Mamdani was named among Canada's top 40 under 40 and has published over 500 studies in peer-reviewed medical journals. Dr. Mamdani also obtained a Doctor of Pharmacy from the University of Michigan and completed a fellowship in pharmacoeconomics and outcomes research at the Detroit Medical Center. And during that fellowship, obtained a Master of Arts degrees in economics from Wayne State University in Detroit with a concentration in econometric theory. As well, Dr. Mamdani completed a Master of Public Health degree from Harvard with a concentration in quantitative methods. And second, I'm really happy to welcome Jennifer Hayward, who's the Vice President of Business Transformation at SE Health. Jennifer is accountable for process, technology, and data solutions with centralized operational support to improve user experience, quality, and performance across all lines of business and home office functional areas of SE Health. Jennifer has been integral in developing new solutions associated with new models of care and establishing the data strategy for SE Health, leveraging AI and analytics to enable data-driven decision-making within the organization. Prior to joining SE Health, Jennifer spent 18 years with Celestica, a global contract manufacturer, where she held various leadership roles in engineering, finance, operations, and account management. Jennifer has a Bachelor of Applied Science and Computer Engineering from U of T and is a graduate of Rotman's Advanced Health Leadership Program. And finally, in her spare time, she enjoys cooking, traveling with her family, and being a pro bono Uber driver to her two daughters, which I can definitely relate to. So with that, I'm going to introduce Aisha Green, who's a senior manager with our AI Institutes, and invites Aisha to start moderating the panel. Thanks so much.
Thank you, Jason, and welcome to all of our panelists. This is definitely going to be an interesting discussion, and we welcome all of you to also contribute to this conversation as well by posting your questions in the chat. So if we can advance to the next slide, wanted to start off in just ground setting. Why is AI important for healthcare? So this is not only meant to be a topical question, but really a relevant question. Love to start that with you, Dr. Mohammed, and in understanding sort of why do you think AI is important within the healthcare sector?
Thank you so much, Aisha. I think everybody's hearing from the headlines in the Globe and Mail, the Toronto Star, and all sorts of media outlets how our healthcare system is in crisis. We have fundamental issues. High patient volumes coupled with challenges in capacity and human resources will make for a highly constrained healthcare system. When we look at the essence of healthcare, though, it's patient-centric and data-driven, really, at the end of the day. And healthcare has a lot of data, right? If we look at a study from Royal Bank of Canada that suggests that of any sector, health has the highest annual growth rate when it comes to data of any sector. So we're essentially kind of drowning in data, but it's challenging in terms of what to do with all of that data. So if we look at studies, new studies published every 2 minutes, there's over 30 million studies that you could look at through PubMed. That's just research alone. And then, of course, when you're actually going through the process of how you manage a patient, think about all that data that you have to process. When you look at a patient, the fundamental journey is around diagnosis, prognosis, and treatment, and then sometimes revisiting. So when we think about a diagnosis, some diagnoses are very simple and straightforward. Others are not at all. So you have to consider things like family history, social history, labs, vitals. We have to look at all sorts of other parameters around medical imaging findings. All of that stuff has to get processed in order to make a diagnosis. When we look at prognosis, that will define how we actually, or drive how we do treatment selection. So for example, if I make a diagnosis, and I'm going to actually just go back to diagnosis for just a sec, it's not as straightforward as people think. So for example, something like asthma. Now, this is not an AI example, but simply how effective we are at making a diagnosis. There have been a few studies, one actually from in North York here in Canada, that looked at patients with asthma. So something as straightforward and common as asthma. I imagine lots of people here either have asthma or know of people who have asthma. They looked at about 500 patients or so. They brought them in and said, we're actually we know that you've been diagnosed with asthma and you're being actively treated for asthma with inhaled steroids and the whole thing. Let's actually step back. We'll do proper spirometry, we'll do proper assessments and see if you actually have diagnosis. And almost a third of patients did not have asthma. So oftentimes we struggle with diagnosis. Then I'm going to go to treatment. Well, if I know this patient isn't going to do well, I'm going to be much more aggressive with my treatment. But if this patient is, they're not so bad, they're going to be okay, I may be a little bit more careful with my treatments, pick something that's maybe not as toxic, has a favorable adverse event profile, maybe take a hit on effectiveness. Well, all of that I have to figure out. And there's study after study after study showing how terrible we are at prognosis. But that drives treatment, right? And then we get to treatment. How many people here know people who have mental health illnesses like depression? I can tell you a lot of physicians, what they'll do is they'll say, all right, I've diagnosed as depression. And in many cases, it's not even depression, it's dysthymia. But let's say we've made the diagnosis. I've got, let's say, 5 or 6 different serotonin-specific reuptake inhibitors to choose from. This is a common class of drugs that people go to. The way people typically make a decision is, let's try this one and see what happens. For multiple sclerosis, similar type of thing. Do we really have a definitive way of saying this is what we start with? No. A lot of times it's, I think we should try this and let's see what happens. There has to be a better way to do this. When we take a look at the average complex medical decision, it's suggested that it considers typically about 1,000 parameters. 1,000 parameters to make a complex medical decision. Now, when we look at Miller's work from the 1950s, who's a famous psychologist, he famously concluded that the average human can process 7 plus or minus 2 things at the same time. So 1,000 versus 7, we don't have a chance, right? It's complicated, and we need help. And we actually, when we look at the types of practices that we have, some of the studies are suggesting that roughly 20% of patients get treatments that are not of proven effectiveness or even potentially harmful. It's more than 1 in 5. And there's all sorts of other statistics about the inefficiencies and the challenges we have in healthcare of making good decisions. So where I see artificial intelligence as being incredibly relevant is it gives us the opportunity to process vast amounts of data in a manner that we as humans simply can't. And we can leverage this power to help us provide better, more timely, more effective, and more efficient care.
That's a fantastic response. And not only something that gives justification as to why AI complements some of our decision making, but also maybe even demystify some of the things that are surrounded around some of the implications of making that decision. Want to switch it over to looking at more of the community side. And Jennifer, same question to you. Why is AI important for healthcare now?
So thanks, Aisha. I think I would echo actually a lot of Dr. Mamdani's sentiments. Not, I think, very similar for some are very similar for home care as they are in acute care. I agree. Data, it's a data and evidence-driven industry. There's a lot of data. I think from a home care perspective, we definitely have challenges in access to data. So access to data in home care can be very difficult. There's a lot of disparate data sets. And so from our side, I think there's a real hope that we can bring those together in the future. If you can imagine as a home care provider, nurse or a PSW going into people's homes, probably 10, 12, 15 visits a day, traveling from home to home, being able not to just provide quality care, but also to be able to assess, where that patient is in their care plan, take into account any other information from primary care providers or hospitals, and then be able to determine, are there other integrated care solutions that can be applied to the client's care. All those things are very difficult to do while, driving to your next visit and trying to consume all that data. So I agree. I think, going forward, there's a lot of opportunity for being able to help our care providers do that. Specifically in the home care industry as well, there are a lot of funding and resourcing challenges currently, especially as a not-for-profit organization such as SE Health. There's not a lot of time for complex analyses, and given the capacity shortages that we have, a lot of the work that we do, especially operational work we do, is very reactive. In addition to the client care, our leadership teams, our clinical managers, are responsible for operational management, making sure that we have the right resources, finding, additional resources when there are gaps. And when it comes to optimizing that, these clinical managers may not be traditionally trained in that operational management area. So how do we provide the right tools to our teams, to allow them to focus on quality client care and then minimize the time that they're spending on that operational management, including capacity optimization? So ultimately, where we've seen some opportunity is, how can we use AI to enable decision-making, but ease that burden? And so allow our teams, the speed of decision-making, allow us to pivot, and then also to anticipate rather than be reactive in their decision-making.
So let's thank you for that, Jennifer. And you touched on something that I think is quite relevant to maybe a lot of people on the call, the people element. So certainly, Dr. Mamdani has provided an interesting as well as clear justification as to why AI is important now, but conveying that to others who are still maybe on the fence, see it as maybe an opportunity to take the decision making away from them. How do you have those type of conversations? How do you start to build it in so that AI is no longer trying to compete with you, but is something that augments your decision making? I do want to bring Jason into the fold, into helping maybe answering and addressing that question. But Mohammed, Jennifer, your initial thoughts on that?
Yeah, I can certainly go forward in terms of some of the challenges. I guess, is that the question, Mauricia?
So more along the challenge of people element. So certainly getting their buy-in, awareness of how AI can actually complement the work that they do.
Yeah, I think a lot of it revolves around literacy. There's data literacy, there's artificial intelligence literacy. But I think at the end of the day, people will understand concepts and such to a certain extent, but I think we need examples, actual real examples of where we've made an impact, made a difference, about outcomes that people actually care about. So when we can get to a point where we can show that artificial intelligence has actually saved lives, where it saves substantial amount of dollars, I think that's when people really start paying attention, because it's those outcomes that I think will drive behavior versus many of the kind of niceties around understanding.
Jason, I see you're coming off mute.
So I think, and there's obviously been a lot of research and studies around how best to educate and communicate the value of AI, whether it's in clinical settings or, again, to enable better patient care. Most of the outcomes focus on, the clinical decision support rather than replacing physicians and such. It's really about how do you provide clinicians and their partners with robust sets of information that's timely, peer-reviewed, and accessible to them at the bedside for the purpose of, again, improving the quality of care, reducing errors, and hopefully, again, making their job easier. So I think the discussion has shifted towards what are some of the greatest limiting factors in terms of clinicians being able to do that today? And how can AI help them in their work to achieve these kinds of outcomes? And it is going to be a journey like any other major innovation. But as Mohammed mentioned, it is about establishing some clear use cases where that impact and outcome is clear, not only to those who participated, but to those outside of that particular trial.
Thank you for that, Jason. Would love to hear from you as well, Jennifer.
Yeah, I agree. I think it's all about really the use case and ensuring that you're really trying to find a problem that resonates with the users and the stakeholders. And then for us, it's been also about including those users and stakeholders in the design of the solution. So, and I would add to that too, the approach has always been not, we're going to use AI to make the decision for you. The approach has always been, no, we want to help you make those decisions, but ultimately, the control is still with you because you are the ultimate decision maker and also the expert, right? So really it's been about that approach of, the tool that I can give you to enable your job, and then involving those stakeholders and users, both in the design and then as well as in the rollout. So not necessarily just, handing over an AI tool, but actually working side by side with the users of the tool so that you understand, number one, has it been designed for the right user experience? Is it actually addressing the problems that they have at hand? Are they able to use it to tweak to what they need in terms of the information? Because sometimes, the information that may be presented to them may not be the right information or may not even be enough information. So all of those things, I think, help with both the adoption as well as the change management and then the buy-in for additional opportunities later for AI.
Thank you for that. I think you've touched on a point of which is really our transition maybe to slide 2 on the use cases. And Jason, I see you coming off mute to probably add on to that. So maybe your reflections can kick us off in terms of successes that you've seen, use cases that are really driving adoption and practice that people can maybe reference and provide a little bit more insights into.
Yeah, and thanks. It was a good segue because I think Jennifer brought up some good points, which is I think your point is critical about who you involve and how you involve people in solution design, development, and rollout is critical. I would say I would even extend that to the use case development itself. So what's the biggest problem we see in the use cases is people have a lack of faith in the generalizability and the scalability of the outcomes of those use cases to their institution or to their practices. And so I think what we have to get better at is who we involve in determining the optimum use cases that will, again, resonate not just in the setting in which it's piloted, but more broadly. And some of the work that we've done within the Canadian healthcare system has done that, which is to ask our sponsors, like, when you look at the outcomes, like who are these outcomes going to apply to? How is it going to ultimately impact on either patient experience, clinician practice, or a combination within? And then work your way backwards to say, how can you actually design those use cases to then have as broad an applicability as possible? And I think that's how we start to drive adoption, is to say these are not limited in the context in which they're introduced, but rather they are examples of how this can be done more broadly.
So I want to maybe shift it over then to Jennifer, because it does touch on to the maturity that an organization needs to have, not only in terms of its infrastructure, data. From a community setting, there are a lot of different inputs. Would love to get your take on some of the use cases and even how you're rolling them out to actually support adoption and spread within the healthcare system.
For sure. So, when we talk about use cases, for us in particular, we wanted to get something that kind of resonated throughout the organization because it's kind of our first foray into AI within SE. For us, we chose one of our major risk areas, which is human resource risk. And that's really something that is recognized and felt deeply from, our CEO down to every, care provider that's going into someone's home. So when it comes to, how can we then do more without the ability to increase staff, given the industry shortage, that's where we decided to see, what could we actually do? I would echo that data literacy was also a challenge when we were looking at the solution. So we really wanted to make sure that we were understanding where people were at in terms of data literacy so that we could accommodate or make sure that we're taking that to account when we were developing the solution, but also the rollout. So the particular use case we decided to go with for SE for our first challenge, and that was we're actually teaming up with Deloitte to do that, is a team geography optimization. So really what it is it's a it takes into account AI-driven forecasting. So historically we were looking at historical volumes, but not predicting volumes based on client demographics, trends we were seeing in the community, et cetera. So we wanted to be able to have an actual AI-driven forecast that will then feed into a tool that allows teams to optimize their staffing geographically in terms of team boundaries. So the purpose of it is to drive visibility to staffing requirements, which is crucial for recruitment, as well as just overall capacity management. And then also for us to be able to increase our capacity by reducing the average travel distances between visits. Clinically, it also provides the right foundation for us to be drive higher client continuity of care. Again, everything kind of revolves around our ability to provide capacity. And so really with this particular project, we're actually finding our initial findings suggest that we can reduce our average travel distance per visit by over 30%. And really that frees up about 2 to 3% of additional capacity, which may not sound very much, but at the end of the day, 2 to 3% equates to about 2,000 to 3,000 additional visits that we can do per week, which has a significant impact on additional clients who are on wait lists for care. And then in terms of what approach we've taken on that change management rollout, as I mentioned, it's been really critical for us to include stakeholders and users across the design, everybody from our leadership team to our clinical managers to coordinators and schedulers, because they all have a part to play when it comes to the operational and capacity management. And as we start to roll out, we're really working side by side with those regional teams to take it from theory into reality. And part of the beauty of the solution that we're providing, again, is the opportunity for our teams to adjust the outputs that the tool provides. So it's not about kind of handing over an optimized geography and saying, okay, go and actually implement it. It's about providing, some of that data, but then also giving them the ability to create custom scenarios if there are geographic nuances, cultural nuances that they need to account for that they know better really than anyone else. And so that allows them to then roll out what they think is best for their geography. And then lastly, I would just say that in order for us to continue on this AI journey, we're really providing like a tech transformation to be able to complement some of the work that we're doing. So we're really investing in and enhancing our data and analytics teams, our business intelligence, but as well adding data scientists into our staff. Fulsome assessments of our data architecture and sources are really key to be able to enable more of those AI opportunities going forward.
Wow, that is impressive. Impressive to say the least, especially for communities, care and community setting. Would love to hear what Unity Health is doing and some of the use cases that have been pushed forward.
Sure, thanks. I think at Unity Health, we're very fortunate. We're the only hospital in the country where our CEO has declared artificial intelligence as a strategic priority. In fact, it's one of the 3 top strategic priorities for the institution. So we have an actual AI living lab with a team of close to 30 data scientists that I lead. And we've developed and deployed live in production as we speak. There are over 40 solutions, most of them using machine learning and AI to drive clinical care. So we have quite a few examples. They focus around automation, optimization, clinical decision support. In the interest of time, maybe I'll just go over a couple of examples. The way our model works, though, is that our data scientists don't drive the questions. The questions have to come from our end users. To Jennifer's point, that end user engagement is absolutely critical. So it's our frontline staff that'll say, hey, this is the problem that I have that I need you to work on. So the problems don't come from the data science team. What we do is we work very, very closely with our end users who co-create solutions that will be effective for our end users. So one example that comes to mind, and again, we've got over 40 of these, is our emergency department nurses came to us and they said, one of our top stressors is assigning our nurses to the different emergency department zones. And we said, really? That sounds really boring. They said, no, this is actually really, really important for us. And there's all sorts of rules that a junior nurse has to be with the senior nurse, has to be with the team lead. The same nurse can't work in the same zone over the past 48 hours. And there's all sorts of rules that they have to adhere to. And as soon as somebody calls in sick, which happens all the time, they've got to redo everything. So their key issue is, number one, it takes us a lot of time from clerical staff to team lead and stuff. We spend about 4 hours a day on this exercise every day on Excel spreadsheets and paper and such. The other thing is, because we have to keep track of everything and it's just really difficult for us to do. The other thing is repeat rates are very difficult for us because we want to minimize those. These are the rates where the same nurses work in the same zones and such. It's just it's a process metric that they really, really are fixated on. It's at around 21%, and that's really high.
Wow. So
we created an algorithm. It's mostly an optimization algorithm, but it's individual level where it basically watches, quote unquote, the nurses in terms of who they work with, where they work, when they work. And you click a button and it'll actually set your next assignment schedule for the next 4 days. And what happens is if somebody calls in sick, you just have to say sick, push the button, and it'll reassess. So what we've seen is post-deployment, the amount of time that was spent went down from, and this was deployed, I think, about 3 years ago, went down from over 4 hours a day to under 15 minutes. And the repeat rate went from over 20% to under 5% in very short order. So now this is, again, used very routinely every day, all day. Another example that may be more important for patient outcomes is something called ChartWatch. It's basically an early warning system. So all of our general internal medicine patients at St. Michael's Hospital and now our surgical patients in general surgery on the 16th floor of St. Michael's Hospital are monitored by ChartWatch. And we're aggressively now expanding hospital-wide into other hospitals as well, where the concept here is very simple. What the algorithm does, and it's been running since October of 2020, so it's been over 2 years of experience that we have now. What it does is every hour on the hour, it grabs data from all of our patients. And for each one of our patients, it categorizes them as business.
So more technical difficulty in terms of recording, but again, impressive in terms of not only the scope and breadth of what can be impacted with just the applications of something that's a predictive modeling like that. I would love to understand sort of the impact of COVID and just seeing sort of what his modeled before and after, but also want to bring in Jason. Jason, I know your purview across the healthcare system is vast and differs. Any use cases that really stand out to you that you could probably share with the audience?
Yeah, happy to. And again, these will be kind of two of a much broader set, but some of the principles Mohammed and Jennifer already talked about. So what are the two areas where I'm seeing some of the greatest demand for AI in healthcare? One is, which again has been touched upon, is digital twinning, simulation modeling type of work. More and more organizations that are looking at processes and flow and trying to understand whether or not there's opportunities to change those processes and what impact those changes would have. So, a good example is things like ER operations, reducing wait times in emergency rooms, potentially diverting patients who are coming into ER that could otherwise be helped by services within the community. Lots of ideas as to how different initiatives could, again, curb those wait times. But to Mohammed's earlier points, in the life sciences part of it, the approach to date has been a lot of throwing things at it and then seeing what the impact is and then making a decision whether or not it was the right thing to do. More and more institutions wanting to model those behaviors and say, can you develop kind of a digital twin of our operation that says, if we, for example, divert 25% of our low CTAS patients who are typically coming to the ER into urgent care centers or into community-based primary care clinics, what impact would that have on wait times? What impact would it have on average length of stay? But even more structural things, which is can you actually change how patients are triaged and seen and admitted within acute care facilities? And again, modeling structural changes to a department to say what impact would those changes have, if you had an initial triage, if you had again a different model for how those patients ultimately are assessed. And so we're seeing an increasing desire to build out more sophisticated models of operations to be able to test different scenarios and model impact. So that's one. The second I would say, which is I think more foundational, is we all know in a healthcare system, and Jennifer raised this before, like huge amounts of data. That data is ultimately collected typically in very fit for purpose systems. So systems that were not meant to integrate, they were not standardized to other systems. They were built fit for purpose, and in many cases have operated for decades within those forms. A lot of the challenge to date has been how do you so-called modernize your infrastructure to be able to make that data more accessible, but not really a desire to do a whole bunch of legacy retirement or massive IT investments. So one of the things we've been seeing is how do you actually extract that data and standardize it at more of an integration layer rather than, again, modernizing and redeveloping the source systems. And so we've seen an increasing desire to bring in machine learning solutions that sit on top of multiple source solutions and do the data standardization, do the metadata standardization, and basically create an interaction layer, whether it's for clinicians or planners or decision makers, to interact with that data at a layer that looks all integrated and feels all integrated, but actually doesn't rely on source integration. That we're seeing more and more desire for because it gets around some of the kind of capital infrastructure investment decisions that have often been barriers to modernizing IT infrastructure.
So Jason, are we at risk in any of these organizations that you've encountered of just producing data lakes? So healthcare has a lot of data. Sometimes not all of it is accessible. How do we it's not really combat, but how do we deal with the deluge of information that everybody has to contend with, interpret, and then, as Dr. Mamdani has said, create a prognosis?
Yeah. You could have a whole webinar on this topic alone.
For future webcasts.
I think a couple of things. One is that the sheer breadth of data is at least partially due to the fact that there's a huge amount of duplication of data collection happening throughout the system. So when you actually start to look at single source of truth and single collection from multiple uses, you do start to address some of the volume of breadth challenges. The other thing, and this gets back to a point Mohammed made earlier, which is we have to return to a state where we're actually working backwards from the needs of your clinicians and the needs of your patients and healthcare system, and then determine what data do you need to satisfy those needs. The reality is there's a lot of data collection happening across the country that, again, is legacy. And we've done multiple assessments where we say, okay, let's look at this set of reports based on this set of data and understand the end use of it. And what have we found? Many of those reports haven't been used in years. But the reality is that the question's not being asked as routinely and frequently as it should be. There should be a consistent feedback loop between what's being collected, how it's being used for reporting, and whether or not, again, that use is justified based on the effort involved in, again, collecting and reporting on the information. The more we do that, we start to rationalize what is like truly that core data set that's necessary for clinical and patient and public use versus all the noise that surrounds it. And I'll stop it. Maybe again, one of the other panelists has other inputs.
So I want to be also mindful of time and the fact that we actually have quite a few questions in our chat and our Q&A. So I do want everybody to, or the panelists at least, to touch briefly on the future the future of AI in healthcare, before we open it up to some of the panel questions. And I want to maybe even layer on this question because it has been such a buzz topic overall since the start of this year, is generative AI. Any thoughts about how that will impact some of the work you do, or even some of the use cases that you have under your purview as well? So probably 1 minute per question, just so that we can be mindful of the questions that are in the chat.
Maybe I can start.
I see Mohammed going off mute. Yeah, go ahead. Go for it.
Sure. So yeah, again, very, very briefly, I think there's an incredible amount of activity that we should be expecting in the future. A survey of 1,000 healthcare professionals, healthcare professional leaders, suggests about 40% of respondents are already using AI. So this is not something that we can just hum and haw about. This is coming, and it's going to be coming very fast. Where I think it's going to be incredibly helpful for us, as Jason points out, there's lots of use cases here, especially around the emergency department. But that's, acute care, but also home care and community setting. As we get more and more into wearables, that is a really, really challenging area. The acute side, I think, will be a bit easier to address. But in terms of new innovations and, let's say, transformer-based models that's driving more generative adversarial models and such, I think the improvements in methodologies will keep coming. I don't think it's going to really fundamentally change how we do things in the short term, though. I think, for example, ChatGPT is based on this transformer technology that's been around for about 4 years now. So it's not new. It's just it takes us a little bit of time to catch up. And I see more and more of these methods advancements happening, but us being the culprits in terms of how quickly we can adapt.
Great insights. How about you, Jennifer? What are your thoughts about the future of AI in healthcare?
So, I mean, I think that obviously it looks like there's lots of things that are being done. For us in particular, I think we see lots of potential. In addition to, enabling that timely and informed decision making, I think specifically there's lots of opportunity in optimizing integrated care, especially as we move away from fee-for-service and start to connect those disparate data sets to have a better view across, a client experience across the system. I think that, when it comes to our quadruple aim, right, better outcomes, lower total cost, patient and provider experience, I can probably name off a bunch of different things within each of those areas where we could apply AI. One of the things that I just kind of came to mind too, as we were discussing, in terms of are we collecting the right data? In some cases, even though we have so much data, in some cases we're not. So I think that that's going to be, crucial to ensure that we're collecting the right data, but then also not burdening our, clinical teams to collect that data. So I think that there's also opportunity there to be able to streamline that process to get the right data, but also not to burden our teams in, drop down forms, et cetera, to be able to get the right information. So I think there's lots that AI can do for that, especially, again, when I think about home care and the time that we're able to spend in people's homes. I'm sure it's the same for, acute care and primary providers as well. The other thing I'll just add is I really have seen their value in engaging external partners. So not necessarily doing everything in-house. For us specifically, especially because we're relatively new to the journey, it's been really great, engaging Deloitte and having them as a partner to challenge our concepts and some of our gut feels, because I can even say, as somebody coming from outside healthcare and being here for 5 or 6 years, you may bring a different perspective that can challenge the status quo or the norms or the concepts that people have. And so I think as we then continue down the AI journey, there's definitely value in being able to partner with external folks outside of the organization and sometimes outside of healthcare to be able to draw on some of those synergies from other industries, but as well as just to get a different perspective.
Great insights. Thank you for that, Jennifer. And I love the idea of having a sounding board to just challenge your thinking. Jason, a couple of thoughts from you before we go to audience questions.
I'll just echo what Jennifer said, and can't stress enough how often we hear about the need to have a more integrated healthcare system and to facilitate more seamless transitions of care. whether it's from acute care to home care to long-term care, primary care. The challenges that exist, including, access to data, sharing of data, standardization, patients' access to their own information to facilitate their care journey. I think that the trend is, for lots of reasons, better patient experience, better clinical access to relevant data, more efficient care. All these things, again, have roots in, again, data, AI, and infrastructure. So when we start to look at, again, how we can facilitate more seamless transitions and a better patient experience, better clinical experience, AI enters that equation in so many places, including, again, more integrated data, including, again, facilitated access to transitions of care, including, simulation modeling and clinical decision making. And so I think part of what I see is the future is starting to think of these things not as, again, individual use cases, but how they ultimately fit within a broader scheme to improve patients' interaction with the healthcare system and improve clinicians' ability to deliver the best quality care.
Thank you for that, Jason. And with that, let's open it up to some audience questions. The first one coming from Ganesh. A lot of application for AI healthcare relates to patient care. Is there any advancements or value in exploring AI to improve medical education? So I think by default, this is going to Dr. Mamdani for your intake on that one.
Yeah, I think, well, first of all, I think we've got to take a human-based approach to actually drive data literacy and AI literacy first and foremost. And how can actually AI be used to drive better education? There's all sorts of applications here. One, I think it can be used in maybe a detrimental way. So, we've heard all those stories with ChatGPT being used by students now to write their essays. And it's hard to tell them apart from human essays. So I think we've got to kind of keep an eye on around misuse of AI in education. But other areas where I've seen, we haven't done this ourselves, but we've seen some pretty interesting work by other places where they actually are able to identify in advance students who may struggle versus students who may not struggle. And assessing different types of learning patterns to say, well, this student may actually be more amenable to this sort of an approach around education versus that sort of an approach. And I think we're going to see more and more of this work around how AI can help us not only deliver education materials, that I think is probably the easier part around allocating to whom what sorts of materials, but understanding what types of people can learn, how they can learn, and who's more likely to succeed versus not succeed in some of our education programs.
That's good insights onto that one. The next question is about wearable technology and the literacy around it. So this audience member finds that a lot of patients struggle with understanding the data from their wearable watches, i.e. understanding sleep cycles, females for understanding their menstrual cycles. So even though we are providing people, I guess, with these tools, what is the information that is conveyed can also be a challenge. Any thoughts or insights onto maybe providing too much data can also be a little bit of a paradox? Go ahead, Mohammed.
So I'm smiling because we learned maybe a little bit the hard way around the importance of human factors, the importance of design considerations, the importance of software development in a way where you're creating a solution that actually really gets at your end user. So, for example, in our program, we have 3 teams. We have a data integration and governance team. And they're the data engineers, the architects and models that really get the data pipelines and clean and scrub that data and get it ready for the algorithm ingestion, which goes to the second team, which is the advanced analytics team. And the advanced analytics team does the fancy schmancy modeling, the neural networks and the optimization models and such. They get into all that stuff, but they're working with good data, so it's more efficient because the data integration governance team has helped them. But the third team, and I'm saying them number 3, but we actually start with this team, is a product development team. Oh. That's headed up by an artist. And the artist has a focus. Now, he actually did a Master of Science in Applied Computing. So he has that kind of lens around machine learning, but he's very interested in human AI interaction and design. How do we actually convey, because our output from the machine learning model is going to be incomprehensible to most people, but how do we convey it in a manner where people can walk away and understand, okay, this is what I need to do with it? And that uptake then is just so much better because it's designed with that end user in mind. That comes first. Otherwise, you're just going to create a solution that nobody can use.
I see Jason and Jennifer nodding. Go ahead, Jason.
I was just going to say, I'd hazard to say it extends well beyond the wearables realm. I think the same principles apply really for any product development, which is if you're not clearly starting with your end user needs, how they're going to interact with the outputs of the information and working your way backwards, you're building this black box paradigm, right? Where people don't understand how and why it's being collected, and therefore they lack the trust in the outputs from that system. And that has come up time and time again in terms of barriers to AI adoption.
Jennifer, I see you nodding, and do you have additional thoughts?
I was just going to say, I mean, we see similar challenges where we have, data collected from, patients through wearables, et cetera. I mean, really, it all depends on the context of the data that's being collected. But then it also, there's a reliance on the clinician as well, right, to help understand, what that means to the patient. And so I think as we get more and more data, I think could be an oversaturation of data without understanding the context or the application to the client. And so at the end of the day, it kind of goes back to, is this something that we need to know? How does it apply to me? And so it's really the user-driven experience, but also, what the user needs and what the client needs.
Thank you for that. And I do want to convey to everybody on the line, I know, unfortunately, we cannot get to all of your questions. We will convey them back to the panelists and see what we can address as we send out the recordings as well as information from this session. I do want to thank the panelists for participating in this roundtable discussion, and then open it up to you, the audience, to help us inform us on future activities as well as events that we have coming in the future. So we would not be doing our job unless we understand how we did our job. So as a data-driven approach, we would love to get your feedback on how we did, and also comments on future sessions that we have coming forward. And to be as topical as possible, we do have a discussion on generative AI coming forward in February the 28th. We'd love to see you in attendance for that one. But with the time that we have, we'd love to get your feedback and thank the panelists for their participation in this discussion. Thank you all. So the poll is live. Feel free to respond, and we'll leave this up as we're going out or signing out for the session. So this will be up for a little bit, but thank you all for participating. And though we didn't kick off the session, Happy New Year to all. Wishing everybody a great AI start to the new year.